Yeah, so you may remember that probably about 4 or 5 weeks ago, I was on ITN, I was on various other outlets, and there was a hope raised then that there might be an antibody test coming through then. And it didn't pass muster with PHE. They didn't think it was reliable enough. And I was reminded of the Chief Medical Officer's comment saying a bad test is worse than no test because it could create a false sense of security. What we're seeing here with the Roche test is what looks like very good news with PHE saying it passes muster with them. They believe it's reliable, and we can now move to having discussions, which we're already doing, with Roche about that. It has the potential to be a real game changer, because although the science continues to be debated about the level of immunity that may exist when someone's previously had the virus, there does appear to be a broad sense among the scientific community that if you've had it, you have a degree of immunity, which means you are safe to go back to work without risk of getting it yourself, or indeed without risking passing it on to others. What you see there, so the chronology here is important, and this was the crux of the to and fro between the Prime Minister and the Leader of the Opposition yesterday, and why the Prime Minister, quite rightly, has pushed back on the assertions made by Sir Keir Starmer about why context is important here. Issues here. The new advice was on the 13th of March, which was about putting in place measures to stop people coming into care homes, to restrict access to the most essential. What I think you're referring to there is the 15th of April, which was the date at which the Health Secretary said, we now have the capacity and the ability to roll out testing and eligibility for testing to all care home staff and residents who they feel need a test. So the PHE advice, I think, was updated at the right time. The scientific advice was, as the circumstances change, we will change the advice, which they did when they started seeing the evidence of community transmission.